Okay, so welcome to session 5. The topic 1 today is going to be medication. Now we know that people take all sorts of different medications for loads of different health reasons. The ones we're going to be concentrating on today are the ones that you may be taking or have prescribed for your pain. Now, often when people talk about medication for pain, they talk about painkillers. We know that there's very few, if any, medications out there that completely kill pain and get rid of it. We're often looking for a reduction in symptoms. And we know that the medications we often take for reducing pain, we call analgesia. Now we've drawn the analgesia here in a bit of a ladder. And we always start at the bottom of the ladder when we're looking to take medication for pain. The one that you've probably tried in the past and might be taking at the moment is paracetamol. It's very readily available. You can buy it in shops. We know that the dose for paracetamol is 500 milligrams in a tablet. We actually take 2 tablets at a time for it to be effective for an adult, and you can take this up to 4 times a day. Now, if you're taking paracetamol at those dosages and it's effective to reduce your pain, you don't need to move up the ladder, and that would be what is most recommended for most people most of the time. However, sometimes if people are finding that it's not effective in reducing the pain, you may be able to buy low-dose cocodamol, again over the counter in the shops, or get prescribed a slightly higher dose of cocodamol. Cocodamol contains codeine and paracetamol. It's a combination of the two, and we wouldn't therefore get anybody to take paracetamol and cocodamol together, otherwise you'd be taking too much of the paracetamol. The lower dose cocodamols that you can buy from the shops, you can take for a few days to help to settle your symptoms if you're having a bit of a flare-up, but we wouldn't recommend taking it longer term because it can have some side effects. Often problems are with your tummy. People often talk about constipation because it slows down your digestive system. The higher dose cocodamols can be prescribed by your GP. However, as they are an opiate, again, they can have side effects. People often feel maybe sick with those, and therefore we would only recommend them taken short term just to settle down pain and then go back to maybe paracetamol again in the future. We don't tend to recommend for persistent pain any of the stronger type opiate medication such as tramadol or morphine, because it's been shown to be less effective for persistent pain than it would be for acute pain, and also side effects which I mentioned you can get with codeine and cocodamol. There are lots of nasty side effects of tramadol. People don't feel very well on it, and morphine, as well as problems with things like addiction. If you are taking some of these stronger medications, the opiate-based ones for pain, and you feel that they're not as effective as you want to be, which is really common, then it's worth speaking to your doctor about this so that they can talk about how to reduce those medications, as we certainly wouldn't advocate coming off them cold turkey because you might get some withdrawal symptoms. We know that sometimes an analgesic on its own might not be as effective as we want it to be, so often people will take other medications as well. We call them adjuncts. A good example would be what we call an NSAID, a non-steroidal anti-inflammatory drug. A lot of people just call them anti-inflammatories, and the most common one you can get over the counter would be ibuprofen, and it would be safe to take paracetamol and ibuprofen, as they do slightly different jobs in different ways. A prescribed anti-inflammatory would be something like naproxen, and you wouldn't be able to mix naproxen and ibuprofen because it could give you problems, for instance, with your tummy. And also some people with asthma find anti-inflammatories, they've got to be careful with those as well. So if you do have those problems, make sure that you speak to your GP or your pharmacist about that. There are other types of pain medication. We call these ones over on the left here neuropathics. They work for nerve pain. Amitriptyline and duloxetine are examples of antidepressant medications which at certain dosages can help with things like pain and sleep. There are other medications out there like gabapentin and pregabalin. These can be used for, again, nerve type of symptoms, not so much sciatica, but if people have neuropathy due to things like diabetes, or if they've had things like shingles and they're getting pain following that, these can be used. And also a small percentage of people who've got fibromyalgia can find that this can be effective. But again, it's not a cure for those sort of pain symptoms in those conditions. It's just to help ease them so that people can go about their normal lives. If you are thinking about getting medication prescribed, changing medication, altering dosages, make sure that you always speak to your GP before you change anything. Okay, thank you.